Hey there, this is a tutorial on how to use Typhon Group. In order to use Typhon Group, we're going to assume that you've already created your template. The template you create when you first log in for the very first time or when you change rotations. So now that we have that, you want to add a new case log. So first what we're going to do is we're going to come over here and we're going to click on Add New Case Log. It's going to ask you now, date of the encounter. So, depending on the day, if you want to be extremely accurate, right now the setting is for you could only input patients times 1 week ago. But I'm going to be lazy today and click today, which is a lie. I'm going to click Save Data. This brings me to the main panel. In this main panel, the thing that's most important is anything that has this red arrow next to it. So I'm in my first rotation. So rotation 1, my rotation is going to be OBGYN. This should already be all defaulted for you. My setting is going to be outpatient because it's in a clinic. Now it's important that you choose underserved area population when it actually is. I'm in an Article 28 clinic, therefore it's for underserved individuals. So I have that selected. With surgical management, you only really want to worry about that if you're on your surgical rotation. Over here, with the patient demographics, it's important that you put in, once again, anything that has your little arrow. So I'm going to say my patient is 25 years old. It's not a prenatal visit. Gender, I would hope to be female since it's OBGYN, and is Hispanic because I'm in Queens. Time with patient, I'm going to put in, I'd say typical is going to be 10 minutes. Now the consult with the preceptor, you probably put about 5 minutes. It all really depends. The type of decision making that I have is straightforward, low, moderate, and high complexity. Well, what's the difference? Okay, straightforward means somebody comes in presenting with sore throat. Okay, it's strep throat. That's pretty straightforward if, that's what they have. Low complexity would be, okay, they have another condition where now you need to probably run a CBC, LFTs, SMA, whatever. In order to make your diagnosis, that's when you choose low complexity. Moderate complexity would be, you have to dig a little bit more and they have more signs and symptoms and it's not really leading you to one diagnosis, possibly two, or something more complex. And high complexity would be, something, where you're going to have to admit your patient because they have a lot of conditions or they have a very morbid condition. So somebody, for example, with CHF that's severely exacerbated, and you're going to need to admit them, or pancreatitis. That'd be of high complexity. Today is going to be, for this patient, an annual GYN follow-up with a pap smear. So it's pretty straightforward. Student participation. I've chosen shared. Now, observation only is kind of self-explanatory. Less than shared, I guess you just are kind of watching, but somewhat helping. Shared and primary are going to be your two biggest ones. Shared means that you are with the physician making patient contact, and you're both reaching a differential diagnosis. Primary would be more on the lines of you are making all the patient contact, and you're just presenting it to your physician for review. So he's not making any patient contact here. You're doing more than 50% of the work with your patient. Today I'm going to do shared 50-50. Reason for the visit. You're going to have a whole list. Go through it, be aware of what the different choices are. Annual well-person exam. The encounter. This is the first time that I have seen my patient. If the patient is, let's say, somebody who always comes back every year, but this is the first time you've seen them, it's still the number one. If this is the second to fifth time you've seen them, in the same day because you're in a hospital setting, or, for any other reason, that's when you're going to choose 2 to 5. 6 to 10 and greater than 10, you're very rarely going to use. This is the first time I've seen my patient. Competencies. This is very important. When I click competencies, it's going to give me a list of all the different choices of things I could have done with procedures. Now, I've chosen to, and I'm going to try and choose as many as I can. I did a pap smear, did a pelvic exam, and I also did a rectal examination. When I go to the top over here is my next boxes I need to fill out. Diagnosis and ICD codes. In another tutorial, I'll show you how to find your ICD codes when you cannot find them in this system. For right now, the ICD and the diagnosis code, you're going to have to get familiar with anyway in your clinical, not even in your clinical years, but when you're a practicing PA. Don't worry about this guy right here. Don't worry about him. You want to come over to the second one, the little piece of paper. This is the box that's going to show up when you click that. Now, the easiest way to go is search only the most common ICD codes. In here, now, I could type in what the diagnosis is. Now, don't forget that in this system, it's not only what you're diagnosing, but it might also include their previous history, what they already have. For example, let's say my patient has a history of hypertension. I'm going to type in hypertension, and I'm going to click search. Here's the different choices that I can go with. These numbers are universal throughout medicine. So I'm going to choose 401.1. This is where it shows up over here. Now, it's recommended that you have at least 2. So let's just say that the patient also has polycystic ovarian syndrome. See how it shows up over here. Now we're done. CPT codes. This is the procedures you've done with a number attached to it. Now, I understand that you've already chosen competencies. However, that's not important now. You still need to list this here. Again, don't worry about this one. Worry about this one. This shows up again. I'm going to choose search only the most common CPT codes. Over here, I'm going to put pap smear. Here's a lot that show up, and this is going to be a pain to find. So I'm going to show you in another tutorial again how to possibly find a different and easier way to get these numbers. For now, I'm going to choose this one. These numbers will always stay the same. So if you find yourself consistently putting in the same diagnosis with ICD and the same CPT codes, write those numbers down so you have them. Now you need to validate your codes. Your validation comes up. It says that, okay, you have this one, okay, and it found this one and it has this one. I'll show you the importance later of why, because when you find the numbers from a separate source other than this program, you need to know if it's validated. Right now, I'm going to close this window. Next are medications. This is if you're prescribing them or if they've already been prescribed them. Now, it doesn't matter, for example, let's say you're going to put your patient on a beta blocker. It doesn't matter the name of the medication. It doesn't matter anything else. All that matters is the class of drug. So I'm going to choose cardiology. I'm going to choose beta blockers. After that, that's it. I'm going to come over here, save data. If you have any missing information, it's going to show up over here. I currently have 2 other cases of missing information. That'll be another tutorial on how to fix that.